Healthcare delivery for any nation points to a calculated system ready to deliver on affordable, available, and qualitative healthcare to her people. Now, what role will such data as records do in playing part of the process, planning, management, and delivery on total wellness to optimal healthcare? Well, I'm wondering too. These and other areas of interest will be our focus for my guest on the spot today. You will meet him shortly. My name is Blessing Abu. Welcome to the program. My guest was born on the 29th of September 1956 at Marina Samia, Sokoto local government area of Sokoto State. He attended School of the Health Records at Madubelo University Teaching Hospital, as in Kaduna, at different point between 1976 to 1977, and between 1981 to 1983 as well. He also took a stint at the School of Health Records of Bafemi Awolowo University in Ife, and that was between 1987 to 1989, before proceeding to the University of Ilorin that's January to March 1994. Haliru Binji College of Arts and Science will also receive him, as well as the Shagari College of Education in Sokoto, for so many areas of interest in education. He has conducted out of several series of research works, with some of them being unpublished. But then, well, picking out one, the role of health records officers in enhancing the quality of patient care. I'm sure that is still vital for today. And he has attended many conferences and workshops with some awards to himself and some traditional titles, including Durbin, Kuya, Madaro. I hope I got that for Kuya district, and that's in Madarokara, Namoda local government area of Zamfara state. He's a member of many professional unions and bodies, including Chairman Medical and Health Workers Union of Nigeria, Sokoto. So that makes him a comrade. So on the spot with me today, I'd like to welcome the Chairman, Health Records Officers Registration Board of Nigeria, Ibrahim Sokoto.
Thank you very much.
Good to have you.
Thank you very much.
Yes, health records is important for us to have data. It is important for us to have records, as the name implies, and it is important to have that to plan. How have we fared in Nigeria?
Well, as the name implies, health record is a collection of information, that are gathered during, consultation between a patient and a doctor. And this information is why we drive all the other, relevant, data that can be useful for planning, as you've rightly said, planning, research, and statistics, and even training of health personnel. Well, so far so good, considering the fact that many institutions, are now very much employing qualified health record officers, though we still have some, backlog of our staff. Some areas are not all that well, manned by health record staff. But looking at the development now, we have many training institutions under health. You have the medical schools, you have the laboratory, you have the nursing and health information management as well. And all this information gathered from patient records are also utilized by the students that are, undergoing training. The same thing with the practitioners themselves. Doctors, use the data so collected in conducting researches into new method of treatment, and also, doing publications of, publications of our health, developments. And we also have other areas, especially where we have an outbreak, such information like, for example, once there is an outbreak, there has to be a we send notification to necessary authorities that make use of such data, in taking necessary action to curtail the menace of whatever, the infections that is occurring.
So perhaps that brings me to the next question, the obvious one. The pandemic has thrown to us so many issues, and it will appear that, well, you wouldn't say we were caught napping, because at the point we were actually working towards taking it on. As we heard, it was a ravage in the other parts of the world. And I'm sure health records to add information at the tip of their hand to say, okay, this is what we're going to be doing with what is available to us in the past years. How did health records step in, the council, how did it step in to addressing issues of health inefficiencies that we had on ground?
Well, you see, let me start by commending the president himself and for appointing presidential task force, and also the minister for health for his partners, in coming in to take, the bull by the horn, ensure that the situation is brought under control. Well, health record is the shopping window of any hospital. That's the first point of contact, because for you to be attended in hospital, you must be properly identified. Your name, your address, age, sex, and what have you. And that's the beginning of records, because all the social information, data about a patient must be captured for anybody to to handle his case. So through that, we do documentation and also forward, the document on the patient to the next level, that is to see the doctor. It's not only when a patient is sick that comes to the hospital. Sometimes they come for advice. Sometimes they come for other medical checkup when they are looking for an appointment. But in this very particular issue, well, record has played a very important role, because in a hospital, it was in a hospital that a patient reported the case, and doctors were able to detect that is the problem we're having at hand, and then such information was immediately transferred to the necessary authority that will wade in and start doing something about it, and that has really helped. Otherwise, if there's no such report of immediately notifiable disease, things will have gone haywire.
Okay. Yes. Now, the role of health records officer in enhancing the quality of patient care is one of your research works.
Exactly.
Over the years, until this moment,
yes,
describe how this has changed the landscape.
Well, I think a lot has been achieved, because like I mentioned, records, one of its importance is teaching, and such records, all the schools under health make use of data so generated from records. Like, for example, a medical student that is sent into hospital for medical experience, we have to function with the available records of past patients, which they now have a look at, and at the same time as they're being taught, they compare the notes and also build on their experience. And at the same time, the consultants that usually handle such type of training programs, they conduct researches on new method of treatment for the patient, and that will help in improving the care of the patient. Because when you look at what you have, like malaria, in the past we were using chloroquine, and it was so investigated that chloroquine is no longer very much the efficacy is very, very low because of the constant use. The bacteria has developed kind of resistance, and therefore research was conducted, and it was ascertained that yes, chloroquine is no longer very efficient, and they have to look for other ways of bringing another drug that can assist in stopping malaria in patients.
So such such documentation gives us aspect to actually look into other areas.
Exactly.
Okay, now this is your second term being as chairman of the council.
Yes, yes.
What would you say are your concerns for the first year of the first tenure, and which are still there, and what other considerations would you want to push to actually take this forward?
Well, our main concern still, and we've been echoing this time without number, that we never had any conventional university in the country that handled training program on records at BSc and Masters and PhD level. We're still running schools with HND. It's only some of the, private universities that are running, BSc programs, and some from outside the country. And those are only universities. Even though we're into now, during this my second year, into agreement with the National State University, we're going very far in making sure that, and they are very much ready to institute a training program on BSc. The same thing with FUTA in Mina. We are also coming off with a postgraduate, training program to prepare our HND, candidates to go into, postgraduate studies. So, but we are still appealing because we have done a lot in that area by, drawing out a benchmark, syllabus, so to say, which we visited the National University Commission. We gave them, and they set up a committee to have a look at it so that they can moderate to make it meet the standard required by their own law, so that other universities, commercial universities, can buy in and also try and institute such kind of training program.
Okay. Ibrahim Sokoto, when we get back from this break, issue of health management information system generally is taking a different dimension across the globe. So we will not be tied down to what we have, perhaps traditionally. But I still want to know how much of this redirection, global best practices, as we want to use the word, is being seen in the hospitals today. And like we pointed out, issue with COVID-19 threw up so many things, such that we're seeing some lapses in the different process to getting quality and also effective healthcare all through the value chain. And I'm sure you saw that too, being thrown up. Definitely we'll want to see where we can redirect attention for the council to actually achieve much in doing its own job. We'll be doing that just after the break.
Okay.
You're watching On The Spot, and my guest, Ibrahim Sokoto, is still seated. We'll be right back to take a look at other aspects of health records in a moment. Okay, welcome back. If you just tuned in, the program is On The Spot, and I still have my guest, Ibrahim Sokoto. He's the chair of the Health Records Registration Council of Nigeria, still seated. Okay, let's get to that very point I said about health systems and information generally.
Exactly.
What is obtainable in the world today is not obviously what we have as well. Take it up from there. Why so till this moment?
Well, we've been making concerted effort actually, because I'm sure you are looking at the issue of computerization.
Exactly. Now you're home.
Yes.
Electronic
health record. Well, we have made a lot of advancement in that area, because I believe there was a kind of correspondence between the board and the Ministry of Health, to the extent that some budget were put in place to make sure that we have, people that will develop, or that have even gone ahead to develop, software that can be accepted
I know a state like Lagos started something.
Yes, Lagos State. Even here in Abuja,
FCT.
Here in Abuja, National Hospital Abuja has gone very far in that respect. But it's localized.
Sure.
And most of the hospitals that are doing it now is localized to their own environment. What we want to have a national outlook.
So what is stopping us achieving that?
We are working assiduously on that, and by the time I think the committee is through with that, I'm sure we will have a unified kind of a program, software program that can be applicable to every health institution.
Exactly what are you looking at? Because I know you're trying to have a total outlook that will be of national bond and all of that.
Because it's good that wherever you go as a citizen of this country,
sure,
whichever hospital you go, you will be able to access your data from whichever hospital you attended. So you can have it at the same time. So that's the kind of program that we want to have.
So what is stopping us?
Well, we are working as serious on that, but I only hope that before the end of my tenure, we're able to achieve that.
How long more do you have?
Well,
because this is your second tenure, and
this is my second tenure, and this is my second year.
So you have like another year or
about 2 or
3 or 3 years.
3 years to come.
So sometimes chief executives, they have noble ideas, they have noble issues to actually want to do to impact a system.
Exactly.
What do you think have been your own constraints in doing some of those noble areas that you want to look at?
Well, I must sincerely commend my registrar. Is such a person that knows when and how to press the button, and he's working assiduously on that, being the chief executive of the board. And we have been having very good working relationship with him, and he's doing very much on that. And I'm sure, inshallah, we'll make it. We'll get to the promised land. Okay. Exactly.
Now let's take a look at what the board is helping the agency also to push through the kind of guidance that we have now with COVID-19, and I'm sure from records so far, since you deal with data, you deal with records to actually move the system to the next level. Well, give and take. We're not praying for another, because we're yet to even sort out this one that we're in.
Exactly. Well, you see, in sort of fact that I said, I commend the president, the presidential task force, and the minister for their steadfastness in trying to carve the merits of the issue. But the unfortunate thing that I took note is that you see, in the past we work as a healthcare team, but for a look of things now, things have been turning the other way around.
How?
Yes, because I think we are only working as a family. I think you understand.
No, I don't.
Because why I say we are working as a family, in checkmating this kind of situation, all health professionals should be involved in all the activities, because everybody has his own role to play.
So do you think...
Be it doctors, nurses, public health, health record, community health, laboratory, and everybody has a very unique role to play. But from look of things, anything that starts is doctors. Whatever is coming up is doctors. And
so
I think
it's health record feeling shortchanged in this process?
Very much.
So tell us...
Because it comes to a level that we have to write to the minister in that respect. That look, in any team there has to be a record officer who should be the data officer, who should maintain, the documentation of the patient, and also collect data of all the activities carried out in the process of combating this COVID-19.
Okay. So are you saying
in the hospitals, they are the one doing documentation in some of the hospitals. But when it comes to the national level, you hardly see anybody invited into that. Of recent, I learned that
if your people are all over the nation as it's expected,
yes,
as record officers,
yes,
how come they're not being seen at the national level?
Well, you see, because there seems to be kind of, you know, I don't know how to explain it, but it seems, it's like I said, it's a family affair. They hardly invite, you know, other professionals to be on board with them.
Okay. So how
like what we're always not seeing.
How are you stepping in to address this particular worry of yours?
We have written a very strong worded letter to the ministry.
Okay. How long ago was this?
Well, it's not quite long. I think it's not up to a month. And I'm sure
the situation started since February in Nigeria.
But we have been making concerted effort to ensure that we are there.
Okay.
But nobody hits. But it's good for us to comment it now.
Okay.
So that posterity will judge us.
So on the sideline, even though you're letting me know that you were sidelined in the scheme of things.
Yes.
What kind of records are you documenting now? What kind of are you keeping now, even as you have the situation on the ground?
Well, at other hospitals level, you know, like I mentioned, it is the responsibility of record officer to document the patient. And at the same time, after the patient is being discharged, even before then, we collect the number of cases that come into the hospital, number of cases, there's number of cases that tested positive and those that are negative. And at the same time, those that have been cured and those that have died and those that are still in the hospital. Now, when you admit patients in the ward, for example, today you admit 20. Tomorrow, maybe one is discharged, one died, or five discharged, one died, another two discharged. You have to know the total number of patients remaining in the hospital, and that's how it should be. So at the end of the month, you can now, authoritatively mention the number of patients that were admitted, those that died, and those that are discharged home.
Okay.
And you will also be able to calculate, for example,
for those that could escape even those situations we have shown you. I'm sure you heard of such cases as well.
Well, such cases, I think, it's a local problem, localized in some areas. But in a decent and good environment in hospital, you have to see a patient escaping. Because, well, like you can have a patient that abscond, either with authority or on his own. But then, in this kind of case, you don't let it go like that, because it's a source of danger to the whole community.
Sure.
So you must have to follow up and trace that patient through the documentation that he had earlier before he's been admitted. His address, his next of kin, and there's something, and you'll be able to trace him and bring him back in that respect.
All right. I know you mentioned some of those areas of training earlier. Now, with the existence of organizations such as the council, taking a look at training, school, and also management generally, where are the ups and downs in the area of getting the core professionals to come in, impart their own knowledge, and also what kind of interest you get across the nation for people to actually come into this subsector in the health
well, there's been a very tremendous achievement in that area. People do come in for training program. And so far now, I think we can boast of about 123 training institutions across the nation, where we have, the diploma courses around under schools in the teaching hospitals, while professional diploma is run under, schools of health technologies. And almost all the states, you may have 1, 2, 3, up to 4 school health technologies. And there are always, candidates coming in for the training program.
So how easy is the regulating them? How easy is it being for the council?
Very easy, because, it is the responsibility of the board to accredit and license the practitioners. So we do go for accreditation unless and until institutions meet up with the requirement of the board. It's only then we give them accreditation.
So none has been operating without you?
No, none has been operating without. To
your knowledge?
To the best of our knowledge, we don't have any institution.
But should there be? What are the penalties?
We immediately call them to order and close down the institution. You must have that, because you see, nobody can go. You can't train, because we some of them, we conduct examination for the professional diploma. We conduct the examination for them, and we give them license. And those that are trained under teachers, where they are also being, certificated, we also have to conduct examination for them to license them, to make sure that they are off to.
Yes, I asked that because I know so many people operate on the this is health we're talking about, and it has to be with the permission of that individual to want to stay alive.
Exactly.
Chairman, Health Records Officers Registration Board of Nigeria, Ibrahim Sokoto. Thank you very much for coming on the spot.
Thank you very much.
I appreciate your time and your insight on the program.
Thank you very much.
And that's it on this edition of the program On the Spot. We hope you find time again and join us on another interesting edition with another interesting guest that will be coming your way. My name is Blessing Abu. Goodbye.